The very first speaker that we have is Dr. Afzal Javed. He has sent us his video message, which I'll play from my side, and then probably everybody will join.
We'll start with Dr. Afzal Javed. Yeah. Then we'll go to Dr. Fawad Abdullah. Fawad is here.
So let me check if he's here. Yeah, he is here. So I'm going to make him a co-host as well, so he can also
share his slides. Yeah.
Yeah.
Did he send his slides to you or no?
Yeah, he has. No, he hasn't sent his slides.
So he will share. He will share slides behind.
Yeah.
Assalamu alaikum.
Assalamu alaikum. Assalam. Kaifa halak?
Yeah. Alhamdulillah.
MashaAllah. Good to see you.
Alhamdulillah. Alhamdulillah. I'm here.
Wassalam. How about Dr. Ulster, Dr. Sharaf Noor?
Yeah, she has sent her slides, and let me see if she is here. No, she is not here.
Okay. How about Dr. Adil Misk?
Let me see if he is here. Adil. No, he's also not here.
Okay.
But I guess
did he send his slide?
Yeah, he did. He has sent his talk. Yes.
Okay. Okay. Now, do we start with Tilawat or we just start directly?
Sir, I'll just introduce you and the rest of the speakers. And then if you want, we can play a recitation as well.
Oh, that's all right. That's all right. If it's
okay,
we can start with Bismillah Rahman Rahim. That's also
right, sir. I'll do that.
Okay.
Sir, with your permission, should I start?
1 more minute.
Okay.
To be on time.
So should I start now?
Yeah, go ahead.
Okay. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and good day, ladies and gentlemen. I welcome you all to COMSTECH Webinar entitled Armed Conflicts, War and Brain Health. This webinar will be delivered by distinguished speakers and will be moderated by Professor Dr. Muhammad Wase, who is an acclaimed neurologist associated with Aga Khan University, Pakistan. The speakers that we have today, we have Professor Dr. Muhammad Afzal Javed. He is the past president World Psychiatry Association. We also have Dr. Fawad Abdullah from Egypt. He's again a past president of African Academy of Neurology. We have Professor Dr. Öztürk from Turkey. She's associated with the World Federation of Neurology, and Professor Dr. Adil Misk. And he's an associate professor of neurology at Al-Quds University, Palestine. Of course, our moderator, Professor Dr. Wase, will introduce all of these speakers in detail to you, and also their topics that will be covered in this webinar. Ladies and gentlemen, on behalf of COMSTECH and myself, I thank our speakers and also our moderator for their time and for this webinar, and also the participants who have joined us from different corners of the world for their participation. This webinar will cover a topic which is very close to our hearts and also of many brothers and sisters residing in the OIC member states. And the speakers of this webinar will delve into various aspects of the brain health and what is the impact of the armed conflicts on the brain health. With this, I would request our distinguished moderator, Professor Dr. Muhammad Wase, to please take over and begin the program. Sir, over to you.
Thank you. Assalamu alaikum, everyone, and thanks, Fazima, for introducing me and the speakers. You all are aware that this is a very important topic. There's no news at this point in the world which is not discussing this issue. And this is a global issue, war and armed conflicts, not only in Palestine, which is like the most affected region at this point in the world, but there are other parts of the world when this is happening. And it's not only affecting the people in those parts of the world where the war is happening, but actually is affecting all the people in the world. So we have a world of 8.1 billion population, and out of which more than 2.5 billion are Muslim population in the world with more than 57 countries. And OIC is the representative organization of Islamic countries, and COMSTECH is the subsidiary of OIC. So I'm really thankful to COMSTECH for taking this initiative and organizing this activity. This is not only going to discuss that what is going on in that part of the world, but it's how it is affecting the whole world and how it's going to impact the whole world in future. So this is a very important topic, and I'm thankful to all the speakers, especially Dr. Fawad Abdullah. Fawad Abdullah is already working on a research paper related to genocide and brain health, and Dr. Öztürk from Turkey and Dr. Adil Musk from Palestine. He will also be able to tell you the real life stories, what's happening in that part of the world and how it's not only affecting that region, but the whole world. So we will start with our first presentation. Dr. Afzal Javed is well known to us. He has been the president of World Psychiatry Association for many years, and he is based in UK. He was not able to join at this session live, so we got a video recorded message for him for this important session. So first we are going to play Dr. Afzal Javed's video, and then we will go to the lectures, and at the end we will have time for question and answers. And if you want to ask any question, you can always put your questions in the chat, so we will be able to look at it and we will ask the question at the end. So first I would ask Kazima to please play the video of Dr. Afzal Javed.
Okay, sir. I'm going to play the video. So just let me know if you can hear the sound.
Bismillahirrahmanirrahim. Good afternoon, respected chairman of the webinar, dear friends, ladies and gentlemen. Let me first thank the organizers for inviting me to this very important webinar, the topic of which is not only topical but also significant in our current scenarios. It is indeed a very important area that wars, conflicts, and traumas are not only affecting the societies in general, but particularly regarding the mental health aspects of day-to-day living. Before I talk about the impacts of wars and conflicts on mental health, let me start with giving a short description of the importance of mental health. Current data, whether this is from developed countries or developing countries, confirm that around 20 to 25% of general population suffer from some mental health problems. Two notions have really gained a lot of recognition. One, it is very clearly mentioned that there is no health without mental health. And the second one, that around 1 in 4 or 1 in 5 of our population will have one or some another type of mental health issues. Now, when it comes to the wars, conflicts, and traumas, unfortunately, the associated stress that increases the significance of mental health while coping with these issues. The current rough estimate is that there are a number of events that are taking place all over the globe, which could be classified as war, conflict, or trauma-related events. The rough estimate is that around plus 40 such events are taking place all over the globe. Now, when it comes to the recognition of mental health problems, this can have the impact in various ways. Number one, those who are already suffering from mental health problems may be subject to additional difficulties in their coping. The stress of living in an environment which is stress generating will definitely increase new cases and new issues for those who may not be having any underlying mental health problem. The third thing is that the coverage of the wars and conflicts and traumas through social media, print media, and all other communications actually make things more vulnerable for the rest of the population, and that is certainly a matter of great importance and significance. Just imagine what happens when our younger generation, children, and vulnerable people are witnessing the horrors of wars and conflicts on the media. And everyone gets sensitized for getting some more insight into these ongoing issues. One thing is very certain, and that is more specific for low and middle income countries, that we are not ready to cope with these adversities. I think using this platform, I hope the organizers of this webinar will emphasize that a country like Pakistan, which is geopolitically very vulnerable, we should ask our government and authorities to expand the disaster management program with a specific input towards mental well-being. I hope the deliberations of this webinar and the recommendations will be taken seriously by the authorities, and we will be able to have some concrete program and plans in place. I once again thank the organizers and hope that this effort will have its greater impact during the next coming years. Thank you very much.
We would like to thank Professor Dr. Afzal Javed for his video recorded message, and hopefully he will be with us soon for his live lecture at this topic and other topic. Now, there are a few things. Number one, if you want to ask any questions or you want to raise any comments, please write down in the chat box. So you don't need to raise hands at this point. Number two, don't share your email addresses and numbers on the chat box. Only write down the questions and concerns and queries. I learned that the voice quality was not very good for this video recorded lecture. Some of the participants have issues. So hopefully you should not have any problem with Dr. Fahad Abdullah's lecture. But if there is one, please let us know so we can fix the problem. Now I am going to invite my dear friend, Professor Dr. Fahad Abdullah, who is a professor of neurology at Cairo University. He has been very active in the field of neurology and a very important advocate of neurology in the African part of the world. So he has been the past president of African Academy of Neurology. He has been a member of the board of director of World Stroke Organization. And as Egypt is the neighboring country to Gaza, and Gaza and Palestine, Gaza was even once part of Egypt. So he has a lot of information to share. And he will not only talk about what's happening related to genocide in the Palestine area, but he will also discuss that how this genocide is affecting the global brain health and how it's going to affect the global brain health in future. So I would like to invite Professor Dr. Fawad Abdullah to deliver his lecture. Dr. Fawad Abdullah.
Assalamu alaikum, Professor Wasai. Thank you so much for a nice introduction. And also, I'm very glad to share with OIC and COMSTECH this important webinar during this critical time. So please allow me to share my slides.
You can share your slides because you are the admin now.
Okay. It is now appearing on the screen.
Yes, we can see you
Yeah.
and your slides, and we can hear your voice too. Go ahead.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. I will introduce very brief communications about genocide and brain health. This is my disclosure. This is my agenda. I will take care of what is genocide, some examples of recent genocide act, what is the brain of perpetrators, what is the brain of people observing genocide, and what is the effect of genocide on the victims. I stuck now with the slides. It is not moving.
Can you go back and then reshare?
Okay, what is genocide? Genocide represents 5 main acts, including mass killing, causing serious bodily or mental harm.
We don't have your slide number 4 on board, Dr. Fawad. Can you share slide number 4?
Yeah, you are seeing now my slides?
You're seeing, now, but not the slide you are talking.
I am starting from the beginning. Are you seeing?
Yeah, we are seeing. Yeah, but the first slide we are seeing.
Yes, it's okay. So you see this slide, what is genocide?
No.
Oh, so let me go again. I stop sharing. I stop sharing. It's okay. So I'm sharing again.
Now we are seeing slide of examples of recent genocide.
Okay, but it is not moving. It is stuck.
Yeah.
So
then maybe Khazima, can you share slides from your end? And
Sir, I can share the slides, but Dr. Font, have you sent it to me via email?
No, I can try.
Yeah, you just send them now. I'll play it from here. It will just take a few minutes, I think, rather than, or either just send me in the chat box. You can also send the file in the chat box, up to you. You can either email it to me or just send it to the chat box.
Okay, now?
Yes, yes. Okay.
Yes.
Yeah.
because I think there is some technical issue. It's not moving from your computer.
Now you are seeing me, my slides?
No?
Not?
No.
Okay. So let me start from the beginning again. I go here.
Did you send your slides to Hazima?
Yes, I'm sending now.
Okay, you send to her, and in the meantime, you can keep trying.
And Dr. Fahd, I think one thing you can also is that you log out and you try log in again, but that also solves problems sometimes.
I send it to you, Hazima, my slides, and I am trying also to share it again.
Okay, that's all.
So
Hazima, let us know once you receive it.
Yes, sir. There is some delay with my emails, so just wait a bit.
it is now on the screen.
It's coming here.
Yeah.
Now try to move the slides.
Okay, it's moving.
No.
Okay, Dr. Fahd, I have your slides, so I'm going to share them so you can just.
Okay.
Can you stop sharing, and then she will share the
Okay.
slide for you.
Okay, okay.
For participants, I would appreciate if you can lower your hands and communicate via chat box.
Okay, so can you see the slides and also see
Yeah,
them?
we can see it now.
Yes,
Yep.
yes. That's perfect.
Go
That's
to slide
perfect.
number 3.
Yeah.
Yeah.
Okay. So we need to know what is genocide. Genocide is defined by the Article 2, subsection B of the Geneva on Genocide Convention as 5 acts: mass killing, causing serious bodily or mental harm, inflicting horrific conditions on a group, preventing persons, and forcibly transferring.
Can you go back, Hazima?
Please. Yes,
Yeah.
and forcibly transferring children. There are 2 key variables that most frequently guide genocide: the scale and intensity of violence. We need to know that genocide is not an event, it is a process. It is not only biological or physical destruction, it is also social and cultural destruction of a community. Next. Yeah. This is some examples of recent genocide in the last 50 years, since 1975. Unfortunately, in the era of modernization and era of international law, as we see in the slide, many and multiple genocide acts have been in the world. So we need to understand what is beyond and behind the genocide. Next.
Next slide, yeah.
So we need to know, we need to know what is the brain behind the genocide. It is not usually the genocide perpetrator says that it is not me, it is my brain. I didn't do the act, my brain does, my brain did. So we need to know the mechanism behind the brain of perpetrators. Next. The brain of genocidal perpetrators, how apparently ordinary people turn to extremes. How does it come? Next. Research is limited in this area, but the most accepted theory is the brain transformation theory. We know that 3 hidden concepts in normal brain, present in our brains, but it is hidden, is the ethnocentrism. Ethnocentrism is the perception of our own group as superiors. Then xenophobia, the extreme fear of outsiders. And finally, the aggression and the violence. It is an innate desire of the human brain for power, especially power over death. Next. So, all these 3 concepts are hidden and innate in the brain of the human being, but it is under the control of the moral judgment area in the brain. It is repressed by the moral judgment area in the brain. The moral judgment area is located in the prefrontal cortex, angular gyrus, temporal cortex, and the amygdala is a part of the temporal lobe and of the limbic system that work as an operational center for input and output act of emotions, morals, and behavior. These areas are found to be activated during moral judgment, and that is studied well by what we call functional MRI. So it looks that the brain of perpetrators, brain of people who commit the genocide, have some transformation in the area of moral judgment. Some transformation makes them change from apparently normal to extremes with very extreme violence and behavior. Next. So what is about the brain of genocide observers? People are looking to the genocide act. People are witnessing the genocide act. Why people adapt to the horror of the society around them and they keep silence? Next. It is the habituation theory. Habituation is a complex process where an organism reduces its response to a repeated stimulus over time. Next. And that is a good example for applying brain habituation in social media users after a major tragic event. First, people are start sharing sympathy and then getting more and more on the boat. Then it is overloading the boat. We will never forget, we will never stop sharing. And then after that, they started to ask, who should be in this boat? Who is responsible to be in sympathy? Who should be responsible to take care of this tragedy? And then what is the destination of this tragedy? And finally, it is confirmed in what we say that mimifying the boat, the last phase of the reaction process, which indicates that the mass hysteria finally slow down in the phase of creating menace. Next. So what is the effect of genocide on the brain of the victims? It is, now we know how the genocide perpetrators have their brain transformed into extreme violence and to the act of evil, and how people observing the genocide can be habituated. But what happened actually to the people who are the victims of genocide, either psychological or organic? Next. Psychological effect of genocide on the brain. we know the post-traumatic stress disorder syndrome. That's one side, and the other side, the impact on social and communication disorder. Next. Post-traumatic stress disorder is defined as a mental health condition that triggered by a terrifying event, either experiencing it or witnessing it. It has multitude of symptoms, multitude of clinical presentation. The most important is the vivid flashback. The victim usually lives in the event, feeling like the trauma is happening right now. He or she has intrusive thoughts or images, nightmares, intense distress at real, just symbolic reminders of the trauma, and lots of physical sensation, what we call somatization, such pain, aches, sweating, tremors, nausea, and so on. Next. There are two types of post-traumatic stress disorder. The acute stress disorder, which usually begin and end within 1 month. And then the complex post-traumatic stress disorder, which is lasting more than 1 month and even lifelong, and sometimes it is very difficult to treat and to manage. Next. The social and communication disorder. Brain is a social organ. We have to understand that this social organ is part of an environment, and it interacts at both biological and social level. Prolonged isolation in campus and in around as a control of forced army let the person's capacity to participate as a part of community diminished. The effect of genocide on the children development, on their linguistic effect development, and in their social and communication abilities, who witnessed and who survived from the genocide. It has a very devastating effect in the social capability and on the communication skills due to isolation of the brain. Next. What is the organic effect of genocide on the brain? We have the traumatic brain injury, TBI. We have the chronic traumatic encephalopathy, CTE. We have infections, and also we have disruption of brain plasticity. Next. During the Genocide Act, there are multiple of different trauma severity and intensity. May be mild, may be moderate, may be severe, and each trauma has its own impact on, direct impact on the brain injury, ranging from minor injury up to severe devastating injury. And it has different level of affection on the brain function and consequently on the clinical presentation of the patient of traumatic brain injury, from mild symptoms up to vegetative state and severe disability. Next. The chronic traumatic encephalopathy is a chronic condition to those people who are exposed to repetitive minor trauma over long time. And each time this trauma may trigger a pathogenesis affecting the neuronal connection. Next. What actually happens with chronic traumatic encephalopathy is that there is a start of release of the phosphorylated tau protein, which is started to be deposited in the perivascular area of the brain, then comes to the superficial cortical area, then involving with time the deep subcortical area, then involving the medial temporal loop. And at that time, it makes damage and degeneration and presenting like the neurodegenerative disease of dementia. So the patient with chronic traumatic encephalopathy has an ongoing process of deposition of abnormal phosphorylated tau protein and the formation of pathological, what we call neurofibrillary tangles and amyloid angiopathy. Next. Infection. Trauma lead to precipitate to different microorganisms and different bacteria to enter to the brain. And then it turns into a disease of the brain like meningitis or encephalitis with different presentation. The scenario is very devastating because in the setting of the mass exposure and concentration camps, the infection will be transmitted from one side to the other. And also it is much more complicated by inadequate medical care and the lack of medication and also vaccination. So trauma trigger infection, and then due to the lack of facilities and the lack of medical care and due to the mass exposure, the infection spread and become endemic. Next. What is the effect on brain plasticity? Plasticity is a condition defined by the capacity of a thing or an organ to both give and receive. It is an both sides way, and plasticity depends in many factors. And the plasticity passing through different stages. The first stage is ontogenetic plasticity, which is the basic process. It's the concrete formation of neuronal synapse. Then it comes to generative plasticity, which is the interneuronal connection, and it is a key capacity of the body. And finally, the regenerative plasticity appears only when there is an injury. When the human exposed to injury, sometimes he needs regenerative plasticity for repair and healing. Next, what actually happened that repeated trauma and the breaking of the blood-brain barrier usually inhibit the ontogenetic plasticity to pass to generative plasticity, and that impact the early development of human being characters and capabilities for education, for memory, for communication, for behavior. And also if the normal individual got injured, the repeated trauma and the breaking of the blood-brain barrier make the regenerative plasticity not to happen, and that impairs the repair and the healing of the injured organs. Next. Okay, that is, I finished my agenda now. We know now what is genocide. We got an overview about the examples of recent genocide act in the last 50 years, starting from Cambodia until Gaza now. We understand the theory of brain transformation, and that's why people turn from apparently normal to extremes, what we call perpetrators of genocide. And also we understood how comes for people observing the genocide that they got tolerance and habituation. And we get an overview also about the effect of genocide on the brain victims, psychological and at the organic level. Next. So my conclusion is that genocide is an act of evil. It is non-human humanity. We need to develop plans for improving health infrastructure during conflict and post-conflict timing. We need to searching for ways of repair, because the actual challenge will come after the end of genocide. How we can help the genocide survivors, how we can make repair for the psychological, cognitive, and the neurological disabilities. Are we ready or not? Further research for long-term effect of genocide on the brain and the nervous system. We have to know that genocide, its impact is not just during the genocide act. It has a long-term, remote impact, even lifelong impact. Next. Next, my recommendation is we need to end genocide now and to bring peace together. Thank you.
Thank you, Dr. Fahd Abdullah. We will take questions at the end of the session. So you can write down your questions and then we'll come back to you and take questions. Yeah. Now we go to the next presenter, and you can stop sharing these slides, Fatima. Okay. So now we go to the next presentation, which is by Professor Dr. Sharaf Noor Ostur. Dr. Sharaf Noor is with us now. Fazima, can you check and
Sir, give me a
check?
minute. Checking.
Yeah.
No, I don't see her.
Okay.
No, but
Is Dr.
we have Dr. Adil Musk.
Okay, so I think we could have Dr. Adil Musk as the speaker, and then in the meantime, you can contact Dr. Sharaf Noor. So now let me invite our next speaker, which is Professor Dr. Adil Musk. He's a consultant neurologist and associate professor of neurology at Al-Quds University of Palestine. He is also Palestine Neurology Association representative and representing at the World Federation of Neurology and the Pan-Arab Neurology Society. Dr. Adil Musk is in Al-Quds, and he will be talking about regional impact of Palestine war. Professor Dr. Adil Musk. Dr. Adil, can we share your slides from here? Is that okay with you?
Yes. Yeah.
Kazima, can you share his slides?
The one? Okay, you have to share it?
Let me check. Kazima can share. Kazima, are you sharing? Kazima? All the participants, we will take questions at the end. So just keep writing your question in the chat box. We'll take at the end. Kazima, can you share slides of Dr. Adil Musk?
Sir, I'm going to share the slides. Just give me a minute, please.
Dr. Adil, in the meantime, you can.
Yes.
Okay, now your slides are on. Yeah, go ahead.
Okay, thank you.
Please start.
Thank you. السلام عليكم.
وعليكم السلام.
جمعة مباركة للجميع. And blessed Friday for all of you. I would like to thank you to give me the chance and the opportunity to talk about what happened in Palestine, especially in Gaza region. You know that, and my talk will focus on the regional impact of Israeli aggression on Gaza Strip. Please, the next.
Next slide.
Please. This is the map of Gaza Strip. It is in the south of Palestine. And I'm going to talk about a little bit information about Gaza. Next slide, please. Next. Gaza Strip there is a population of 2.3 million of people. The area of Gaza Strip is 365 square kilometers. Gaza Strip is one of the most densely population region in the world. The population density of Gaza is approximately between 5 to 6,000 people per square kilometer. Gaza Strip is a home to 8 official Palestinian refugee camps administered by the United Nations UNRWA. In the East, the camps were established to accommodate Palestinian refugees who were displaced during the 1948 catastrophe, Nakba, what you are calling the Nakba. These camps are among the most complete area in Gaza with highest unemployment and limited access to basic services with like water, less of low water and electricity and health care. The next, please. Next slide, please. Gaza Strip is under Israeli siege since 2007 after Hamas won the election. Tightly controlled system of checkpoints primarily managed by Israeli authorities. At least there is 5 checkpoints. These checkpoints are critical for the regulation of humanitarian aid, for the movement of goods and the entry and exit of the people, including medical patients and aid workers. There is 35 to 36 hospitals distributed in Gaza, distributed in public hospital and the private hospital and UNRWA hospital. The public hospital operated by the Palestinian Minister of Health, which provide the majority of healthcare services. Private hospital running by non-government organizations, NGOs, and the UNRWA is from the specifically serving the refugee population. Just to know that Gaza hospital have been targeted intentionally and many times during the aggression. The next, please. Next slide. The Israeli occupation forces today arrived to its 230 days of aggression against Gaza Strip. This has led a different impact on regional and international level. Next, please. The first one, let us to talk about the political repercussion in the Arab world and the Muslim world. It was a huge solidarity, the public protest and demonstration increasing the pressure on government, particularly in countries that have normalized relation with Israel, such as Egypt, Jordan, and United Arab Emirates. This had led to a large-scale condemnation of Israel action. Concerning the relation between Israel and its neighbor countries, as well as between Israel and the other Middle Eastern nations, are strained. Countries like Lebanon, for example, and Syria and Iran have intensified their rhetoric and support for Palestinian people. The media and advocacy in the Arab world have extensively covered the Israeli aggression against Gaza, often highlighting the humanitarian impact and expressing public support for Gaza. Social media campaigning and advocacy by civil society groups have also played a crucial role in raising awareness and mobilizing support. Next, please. The second point, to talk about the social and cultural impact. As of May 2024, at least 147 journalists and media workers have been confirmed killed, with the majority being Palestinians. This makes high deadline period for the journalists Specifically, Palestinian journalists face extremely high risk due to the intense Israeli airstrikes and ground assaults in Gaza, which have also disrupted communication and created hard working conditions. The situation of journalists, including not only fatalists, but also numerous arrests, threats, and instances of censorship, reported indicated that 38 journalists have been arrested since the start of the war, with many still the deterioration reported, and 38 journalists have been placed the several, for example, the journalists have been lost family member due to Israeli aggression. For example, Wa'il al-Dahdouh, he became the famous journalist from Al Jazeera journalist. He became a famous, and including his wife, he lost multiple family members, including his wife and children. Dahdouh himself was injured and later received medical treatment abroad. Next, please. Let us talk the level of humanitarian impact. The catastrophic destruction and widespread, the cause more than 35,000 Palestinians were killed, more than 80,000 were injured, more than 70% of the fatalists were women and children. Concerning the refugee crisis, just to have an idea, 1.7 million people, that's mean more than 75% of the population, have been forcibly displaced within Gaza. A very little percentage had a possibility to travel abroad through humanitarian corridors to get medical care in neighboring countries and Europe. Next, please. Same in the humanitarian pact, the Israeli blocked a food, water, fuel, and essential medicine and supplies, is inflicting immense suffering and on Palestinians and high need of aid. Neighboring countries often had increased their humanitarian assistance both directly and through international cooperation. Currently, just to have an idea, about it's 100% of Gaza are facing a crisis level of food insecurity, which is the highest share ever classified for any area or country. Next, please. What about nutrition? According to the World Federation Program, about 68% of households in Gaza are food insecure. The child malnutrition, approximately 10% of children under 5 years old suffering from chronic malnutrition, to 1.5% suffering from acute malnutrition. Just to have an idea, actually there is more than 50,000 children are estimated to be acutely malnourished. Next, please. What about the health impact? The hospitals in Gaza, for example, are overwhelmed by the influx of casualty. According to the World WHO, the majority of hospitals are operating well beyond their capacity, struggling with shortage of estimated medical supplies and staff. Many health care facilities have been damaged or destroyed by the Israeli aggression. For example, Al-Quds, Al-Shifa Hospital, and other many hospitals were completely destroyed. What about neighboring countries? Countries like Egypt and Jordan, for example, which are already under strain, have diverse resources to provide aid and support to refuge and injury individuals from Gaza. This put additional pressure on the healthcare system. The next, please. The healthcare system, many hospitals and the clinics have been damaged or destroyed, leading to a critical shortage of medical supplies and personnel. Healthcare workers are overwhelmed, facing shortage of essential medicine and equipment while dealing with a massive influx of casualty. Currently, there is a total of 36 hospitals in Gaza Strip. 21 hospitals are out of service completely, 15 partially functioning hospitals, 8 field hospitals functioning, 65% of primary health care centers are not functioning, 25% of UNRWA health centers are operating, over 165 UNRWA staff members have been killed, and many facilities, including schools and clinics, have been destroyed. Next, please. What about the mental health impact? The constant exposure to violence and loss had led a widespread psychological trauma among Gaza's population, especially children. Conditions such as post-traumatic stress disorder, anxiety, and depression are prevalent but remain undertreated due to lack of mental health resources. From the WHO, the psychological impact extending the neighboring countries extend to community in neighboring countries that host Palestinian refugees. These populations also experience a highlight stress and mental health issue due to the proximity to Gaza Strip and the influx of traumatized people. Next, please. The sanitation of and water, the destruction of infrastructure has led to a severe water and sanitation crisis. Over 83% of groundwater will have been destroyed, leading to a high risk of waterborne disease. The crowded and unsanitary condition is shifted on damaged area increase the risk of outbreak of disease such as cholera and dysentery. The neighboring countries, the flux of refugees into neighboring countries such Egypt and Jordan, Lebanon, increase public health challenge. These countries need to provide the health services to growing number of refugees, many of whom arrive with a health issue due to the Israeli aggression and poor living condition in Gaza. Next, please. We have the number and the statistics. Reported damage, just to have an idea, actually we are talking about more than 35,000 of people were killed, more than 80,000 of people they are injured, 70% of them they are children and women, 1.7 million intensely displaced persons, 1 million children in need of mental health and psychosocial support, 17,000 children are separated from their parents, at least 262 all aid worker killed, 493 health worker killed also, 69 civil defense staff killed while on duty, 147 journalists and media workers were killed, more than 60% of residential building destroyed completely, more than 80% of commercial facilities completely destroyed, 155 health facilities damaged, 171 UNRWA installation damaged, and finally 130 ambulances were completely destroyed during duty. Next, please. What is it? Next, please. It is genocide. Thank you for listening.
Thank you, Professor Adil, for a very informative presentation. And Hazima, can you check that if Dr. Sharaf Noor is here or not? Dr. Sharaf Noor is here. So, Hazima, can you stop this presentation and share Dr. Sharaf Noor's presentation? In the meantime, let me introduce Dr. Sharaf Noor. Dr. Sharaf Noor Öztürk is based in Konya, and she is past president of the Turkish Neurology Society. She is now the head of World Federation of Neurology Migrant and Refugee Neurology Specialty Group. And she has written a textbook on migrant and refugees neurology. So she's an expert in refugees health and migrants health. And she will be today talking about environmental impact of this war on the globe. Dr. Sharaf Noor Öztürk. And Khazima, please share her slides. So Dr. Adil, stay with us. We will ask you questions. There are questions for you. Go ahead, Dr. Sharaf Noor. Khadima, can you unmute Dr. Sharaf Noor? Dr. Sharaf Noor, go ahead.
Hi, do you hear me?
Yes, we can hear you.
And do you see me?
We can
You
see
don't.
your
You don't.
slides.
You don't.
Yeah,
You
can
don't see
you
me.
turn on your video, I think.
Yes, but it doesn't work. Okay, now it's okay.
Okay, yeah, go ahead, please.
Okay. Thanks again, Professor Vasai and dear colleagues, for your invitation. This is really very important topic, and as humanity, unfortunately, we are living in a very, very unwanted conditions, and we have too much vulnerable and damaged people. Yes, please.
Next slide, Khazima.
Next slide, please. Next slide. Next, please. Next, please. Yeah, there are many area which have affected by war and conflict because of conflict, armed conflict, and the effect of this very wide war and conflict attack and actions damage environment and directly and indirectly human living conditions. Next, please. Actually, we can talk about effect of war in two groups. One is local effects and the other is migration effects. Next, please. Local effects, next, please. You know, everywhere, if there is a war or there is a armed conflict, women and children are in more danger. And this is true for displaced and also non-displaced groups. Women and children can be affected by conflict even without being displaced from their home. And there are many individuals actually, estimated as approximately 149 million undisplaced people affected by conflict globally. This is not include migration or people who are in condition forced displacement. Next, please. You can see from this graphic increasing number of children and women who are displaced, forced displaced because of conflict, because of armed conflict. Yes, please. Next, please. And more recent estimate indicated that approximately more than 400 million children younger than 18 years were living in areas affected by conflict in 2017, and it's increasing with contribution of new war areas and new armed conflict areas, including Palestine area, also Gaza. We are talking about Gaza. Next, please. Yeah, especially Africa and Middle East countries affected by displacements, and they are very close to war regions and conflict regions. Please, next, please. And mortality is increasing continuously in these regions because violent deaths in Syria, for example, was used to estimate approximately 70% of all violent deaths were civilians, and civilians are in more danger actually. They are dying, they are having many diseases, and these proportions and these rates are increasing with unfortunately unsuccessful political decisions and actions. Next, please. So we must talk about a relationship between war and environment. Even in conditions without war, environment is getting worse because of climate, because of industrial uncontrolled pollutions, because of human actions unwanted. But war is the most important factor for these pollution and these worsening. Next, please. You can see actually these photos from Gaza and reported by United Nations Environment Program. You can see the differences easily. Residential differences between residential area after disengagement and vegetable processing factories, you can see, and after the war or conflict. Next, please. Again, greenhouses area and after disengagement, poultry farm and after disengagement. These are all environmental affected area, worstly affected areas. Next, please. And naturally, there are many unwanted, harmful, dangerous contaminations. And there are very detailed information in the reports. You can reach them. And these are all very harmful for brain health, for neurological disorders and general health. Next, please. So these harms are actually related to exposure time, exposure amount, exposure type, and there are many fuel produced contaminant and poisonous contamination. Asbestos is also very important contaminant because after damaging houses or binaries, there are many uncontrolled asbestosis and dirty weather because of asbestosis. And we all know that asbestosis is really very harmful for general health and also to produce many cancers, chronic diseases. And the radioactivity is another important issue. This is really difficult to measure correctly radioactivity amount because you must collect prompt samples, prompt time. You must use prompt measurement methods. So this is really very difficult, but you must measure regularly in this area radioactivity effect also. Next, please. And so how the environmental factors affected general health and also neurological health. Air pollution, so this is strongly related to war condition, and we know that particulate matters are increasing with the war in armed conflicted areas. Chemical contamination again is really very important, and it is involving soil, water, and sometimes farms. And urbanization is also, and there are many persons collected in a narrow areas. Sometimes this is danger for urbanization. And there's biological aggregations, and all these can cause increase climate change condition. Okay, next, please. So you see the main mechanism with environmental factors. So acute exposure to air pollution, desert dust inhalation after war. You can see brown clouds everywhere, and they are carrying many contaminants and asbestos and particulate matters, sometimes petroleum ingredients. And extreme temperatures also can cause increase in neurological disorders, and geomagnetic storms, again, another factor. Next, please. Next, please. Yeah, air pollution. We all know that air pollution now reported and proved actually that can increase neurological disorders, especially can increase cardiovascular disorders, stroke rate approximately 30%. So naturally, there is important amount of air pollution in war region. Next, please. And atmospheric brown clouds, again, this is also related to air pollution and bombing, explosions. So you can easily imagine how it can affect our health. And main mechanism is endothelial dysfunction, procoagulatory state, cardiac malfunction, and dysfunction of the autonomic system. Yes, please. Yeah. So we must reduce these unwanted atmospheric brown clouds conditions, and this is related to live in a peaceful conditions mainly. Okay, let's go. Yeah, another important danger is malnutrition in armed conflict and war areas, because sometimes natural disasters and war condition can come together, and they can reduce dangerously reduced food supplies and rationing, and we can see decrease in food availability and social disruption, higher food prices. Yeah, we are all very familiar, and hunger, eventually hunger, and at the end of this process, you know, many diseases, malfunctions, and social inequality, and many disorders. Yes, please. Yeah, and infectious diseases, illnesses are another important group in conflict area, because there are crowded population in a limited area, and every infectious disease spread easily, and see all kind of bacterial and viral infections, and including measles, hepatitis, cholera, even next please, WH, yeah, and AIDS also can increase in these conditions because of sexual violent and unwanted actions for women especially. And another important, another important factor is lack of vaccination. So you can imagine how you can vaccinate everybody in that conditions. You cannot find a vaccine, you cannot pay for vaccine, you cannot store, protect your vaccine, and you cannot find anybody to vaccinate. Next, please. And chronic non-communicable diseases are also very important group, because risk factors are increasing in armed conflict area and war, and also in migration groups, because you cannot prevent risk factors, you cannot provide medicine to use in chronic diseases. Yes, please. Next, please. Yeah. And there is poor health facilities, and manpower is not enough for prevention, for treatment of this group, for chronic non-communicable, like cardiovascular diseases, like other chronic neurodegenerative diseases. This is really a very, very difficult condition to prevent or to treat or to care in general. And sustainable development goals may have important roles to improve healthcare quality and successful prevention and treatment of cardiovascular risk factor in these regions. And this is also, again, depends on many, many political issues. Next, please. And mental health are the main group of diseases because of acute stress, post-traumatic stress, anxiety, depression. So these groups are also really importantly increasing. Next, please. Next, please. And non-fatal fatal physical injuries, especially limb amputation and other factor related to local injuries. Next, please. And there is also another group who are affected by war or armed conflicted actions. This is migration effect. Next, please. We know that from prehistoric age, migration a problem as old as humankind history. We are moving and continuously because of disaster, natural disasters, because of economical reasons, because of war and armed conflict actions. Next, please. And there is a new term for refugees because of environmental factor, environmental refugees. Climate and natural disaster factor is really very important. And sorry, my office phone. Next, please. We have different migration types, temporary displacement after disaster, forced permanent migration, forced migration to avoid worsening environmental deterioration. Next, please. And there are many actions against migration effect in population from 1948 to our days. There are many institutions, many organizations involved in to increase quality of life condition in migrant populations. Next, please. And forced displacement because of war is a really very important group, and approximately 40 million displaced people will be living in some of the poorest countries. This is an ironic condition. They are going to low-income countries, especially because high-income countries doesn't accept them. For example, Turkey is a medium income country, and we are accepting a lot of migrants from armed conflict or war area, actually. And we have some difficulties naturally. Next, please. Yeah, there are some main countries for migration because of, Middle East countries are not in peace for years, and this is continuous. And next, please. Next, please. You can see that Syria, Venezuela, Afghanistan, these are the top countries for international displacement. And now Gaza, Palestine or Palestine added to this group of countries. Next, please.
Dr. Sharafnoor, can you finish your presentation in like
sure.
3 minutes? Yeah.
I'm going. Okay. Yeah. Next, please. Next, please. They don't return to their home. Next, please. And women again more affected by war and migration. You can see everywhere. Next, please. And there are many health risks for refugees, including malnutrition, infection, physical injuries, poor mental health, lack of vaccination. You can see all these factors. Next, please. And there is a close relationship between war, political situation, social situation, economic situation, climate change, and, for example, forced stroke, increasing mortality. Next, please. Quickly. We know all burden of neurological disorders is really very high. Next, please. Next, please. Mortality rate, unfortunately, was higher in migrant in reports. Next, please. And within the disability burden, ethnic minorities and internationally displaced persons are really very crowded. Next, please. We need sustainable development goals, prevention, including mainly prevention. Next, please. And advocacy is really very important. As neurologists, we must advocate for these groups living in armed conflict area or migrants. Next, please. And you know, Turkey and refugees, we have more than approximately 4 million refugees, and we are trying to care them. Next, please. These are from our refugee camps before earthquake. Next, please. There are some solutions we can start. Next, please. Next, please. And to increase awareness, to improve health care for these groups are really very important. And we must improve some different techniques to care. Next, please. Next. Next, please. Advocacy again. Next, please. Next, please. Next, please. Yeah, my favorite slide. So provide leadership on health, environment, and climate change is really very, very important, and is a very famous proverb by our great leader Atatürk, peace at home, peace in the world. This is the solution. Next, please. Yeah. And all these migrants just were only looking for a better life, and we must take care of. Thank you.
Thank you, Dr. Sharaf Noor. I think it was a very informative presentation. And now we will take the questions. So we have the Professor Adil Mesk and Dr. Sharaf Noor and Fawad Abdullah to respond to questions. And if you have questions, please post your questions. Some of the participants, they have already posted questions. So there was a question that what is life like for Palestinians in the Gaza Strip? So Dr. Adil Mesk has already responded to that. The other question is this regarding genocide, that what the world can do to stop this genocide. So Dr. Fawad Abdullah, could you respond to this question that, you know, there's already a lot of protest and everything going on across the globe about what the world at this point can do across the globe to stop this genocide?
I think we are, as academics, we have to make awareness about the precise definition of genocide in order to transfer a message, a clear message to the community and to all the world. We need to make more research about the genocide and its long-term effect. So people in the world should high value the dangerous effect of genocide, not only on the victims, but it is also in the neighboring country, in the globe, for the environment, for the economy of the world, and all of that. Additionally, also we are in the Muslim community or in the Middle Eastern countries who are near to the area of conflict, we should to make much more preparation for genocidal act in terms of healthcare system. We need to make a plan. If some countries exposed to conflict, exposed to genocidal act, exposed to forced army conflict, like what happened in Sudan, what is happening now in Gaza, irrespective of the type of conflict, how we care system, I mean, preparing them like airborne helicopter with multiple important essential medications, putting a budget for the essential medications, how we can transfer people to the proper places to take management and stuff like that. Regarding on the long term, I think awareness and awareness and awareness. We need to make a precise definition of genocide in terms of neurological and mental injury. It is not precisely or exclusively a genocide to kill people, many people who are living, but they have major disabilities or major mental injury who cannot be useful in the community or even for themselves.
Okay, thank you, Dr. Adil. Now, Dr. Adil, Professor Adil, we have a question that we have a lot of information now for Gaza, but what's happening in other parts of Palestine, especially West Bank and other parts of Palestine? Dr. Adil, can you?
Yes, I'm concerning the genocide. What we can do, I'm agreed totally with Dr. Abdallah that we need to talk and talk and talk, and to with awareness, not just in the Palestinian area, in the neighboring area, in over all the world. The first thing. The second, it's unacceptable now. We are in 2024. There is an last occupation who occupied Palestinian territory, and the Palestinian people till now, after 76 years, they are suffering from the Israeli occupation. I think what we need, all of us, that to recognize the right of the Palestinian people to have own state, and to have an awareness, and to boycottage the Israeli state to commit this kind of genocide. What happened in the South Africa and the influence of the South Africa, what we need now in 2024 to isolate this aggressive and extra extremist regime in Israel. That's what we need.
Now, what's happening in other parts of Palestine other than Gaza, Professor Adil?
What?
In other parts of Palestine, like West Bank and other parts, are the aggression going on in other parts too?
And in Gaza, now there is other commit, and there is genocide in other places in West Bank, in Jenin, for example, in Tulkarem. Nobody talk about it. Just yesterday, every day there is a victim, every day there is a martyr, they falling down. It's just yesterday, the day before, 12 people were killed. One of them was a teacher, one of them was a physician, a surgeon. I know him well during his work in the hospital of Jenin. And all journalists were isolated the last night till 3 o'clock. And one of them, they were shooted. This is now what happened in West Bank concerning the Israeli soldier from one side, the settlers in the second side. They blocked and they promised all the people. For example, we know that yesterday Spain and Ireland were recognized the Palestinian state. Now the settlers and the Israeli responsibility, they said each state recognize the Palestinian direct or the Palestinian rights, they want to build a new settlement because they didn't accept that the world is going to recognize the rights of the Palestinian people to have their own state. This is what we need. We need all your support, the awareness, and to talk and to protest, not just in the university in the United States and over all the world. This is what we need.
The last question to Professor Sharaf Noor. Now, the question is that the amount of bombing in Gaza area is more than 2 nuclear bombs hit at Hiroshima. So that has a lasting impact. So this amount of bombing in Gaza and this continuous bombing, how it's going to affect the environment of the whole world? Because, you know, the environment is affected by, like, is each bomb is going to affect the global environment. So how it's going to, and how Israel is now part of a huge crime of making environment worse of the world. So how do you think, what is the level of this environmental pollution by Israeli bombing in Gaza area?
Yeah, thank you. The current situation in Gaza is not just only for a crime for human, but also crime for environment. So even in traffic, crowded traffic is causing enormous amount of air pollution, dust, brown dust, chemical contaminations, and noisy anxiety, stress, and cause poisoning. And so we can easily predict that the current war in Gaza will increase air pollution, contaminants in the region, even because there are some reports that people living in 50 kilometers close to this area are all in danger. So they are enlarging as a dangerous area and will influence very dangerously, very severely environmental condition of the region, and everywhere are in relation each other. You know, climate change is one of them, and even climate change could be occurred because of these bombing, war actions, you know, all chemical effects, fire. So I'm not so I'm pessimist actually for this condition. It will seriously affect the world environmental condition. So at least for this reason, if we are not very humanistic, at least for this reason, we must stop this condition as inhabitant in the world.
Thank you. I think at the end, I would like to thank all the speakers, Dr. Fawad Abdullah, Professor Adil Mask, and Sharaf Noor Ozturk, and I would like to thank COMSTECH for organizing this activity. And I'd like to thank all the participants for participating. If you still have any questions, please send us. We will try to get answers for you. We got most of the questions answered, and we hope to see you again. Now, video recording of this session will be available, so you could contact COMSTECH. They will be able to give you a link, and hopefully we will be planning to write down a summary of this webinar for journals and magazine and newsletters. So hopefully you will be able to see part of it, and hopefully we plan to do more seminars related to this topic in future. So again, thank you, and Khazima, thank you very much for organizing this activity. And I'd especially like to thank Iqbal Chaudhry Saab, who is the head of COMSTECH, for giving us this opportunity to organize this activity, and we'll keep in touch. Thanks a lot for everyone.
Thanks. Thank you.
Bye-bye.
Thank you very much. Thank you very much,
Bye-bye.
everybody. Bye-bye.
Thank you. Allah Hafiz.
Bye.